Neck and upper back pain can be very common in golfers. In this video, I want to show you some certain range of motion testing that we can do that'll tell us a lot about what is going on with your neck and upper back pain and discomfort. Further, I want to show you some drills and exercises that we can do to begin improving on that pain, discomfort, and range of motion loss that we might have, and why range of motion at the cervical spine is so essential to the golf kinematic sequence and movements of the golf swing. So if you have neck pain, what might be a cause of this? Whether it's while you're golfing, after you're golfing, or maybe just general when you wake up in the morning, while you exercise, whatever it might be. One common issue of neck pain or discomfort is disc injury, maybe a disc bulge. What happens here is that the disc space between the joints of the neck maybe gets compressed for whatever reason, and we might have a bulge of that disc tissue. What happens there is that it can put pressure on the nerves as they leave the spinal cord, and then we can get some referring pain. So if you have or happen to have this pain, maybe this kind of radiating pain right next to the scapula there, right on the inside edge of the scap, this could be pain that's actually coming from, we call it an injury here at the lower neck. This is a common spot for pain from C5, C6 to be referred, whether it is a local pain there at the neck, or maybe it's a nerve that's being impinged upon, whether it's from a disc injury or not. Now, some other issues that we can get at the neck is just facet arthritis, right? So we get arthritis at the neck, we have extra bone growth, and again, we can get some pain and inflammation through there from this. And the same thing, this bony formation can also start to compress certain nerves. So we get some local pain, we can also get some radiating pain. Common symptoms here might be pain that goes down the arm, same thing with a disc injury. We can get symptoms that shoot down into the arms, and we know that there's probably maybe some disc issue. At least at some point, there is some encroachment on a nerve as it leaves the foramina there at the spine. Some other issues is just facet irritation in general. So the joint capsules here at the back of the joints of the neck, these joints are getting a little bit irritated, and we get this local pain, this kind of achiness through the neck. So now we have some facet irritation that we can work through. Other common symptoms, or issues at the neck is just sprain strains, right? So we strain the muscles around the neck, strain it through the golf swing, through exercise, through creating rigidity and compression through the neck when we're trying to stabilize for certain movements. We can get these strains and sprains there happening at the neck. So the bottom line is we can get a lot of symptoms around the neck that refer into other areas that are not the neck, like the arm, like this upper back next to the scapula, maybe even underneath the scapula. We get some trigger points. It could be arthritis, facet irritation, whatever it might be. There's a lot of different issues that could be happening there at the neck that can resemble other problems as well. So it's important. Get neck pain, upper back pain, radiating pain into the limbs. Get it looked at by a professional. Get a diagnosis and figure out exactly what is the pain generator if we're going to get a deep dive into what you have going on and fixing your problems with a plan specific to you. You need a professional to help you out with that. Otherwise, what are some range of motion testing that we can do at home that'll tell us a little bit more about what's going on? Or what are some low-hanging fruit that we can work on that may help to improve some of the symptoms that you're having? One important test is the cervical flexion test. So I want to know, can you tuck your chin to your chest without cheating by opening your mouth? What we should see here is that you can get your chin to your chest, and you can do it with a relatively uniform spinal curve. There's usually some flat spots here at the neck. As we do this, what we'd like to see that we have a couple hinge points that we're actually getting cervical flexion from. If not, we know that we're getting a few spots, or at least one spot that's doing most of the flexion, usually here at what we call the CT junction, and then at the very first joint here at the top of the neck, while everything in the middle has kind of lost its ability to flex and participate in cervical flexion. The exact opposite is cervical extension. What we want to see is that you're able to get your face about parallel to the ceiling, just less, about 80 degrees. This means that we have enough extension from each of the joints to what we would say is have a normal amount of cervical extension. And this is a big one. This is a motion that a lot of people lack, and it's kind of a precursor to that chronic upper back and neck pain. We start to hinge, we do a really good job of flexing from certain joints, and then we never go back into extension anymore, and we start to get that aching through that upper back and neck. So cervical extension is critical if we're going to be working through neck and upper back pain to make sure that we've restored cervical extension where we need it, when we need it. Another thing we can look at is just simply cervical rotation. So without letting the trunk come along for the ride, can I rotate my chin over mid clavicle and kind of touch the clavicle as I come down. If I get stuck here and I can't get to the clavicle, which is closer over here, then I know I have a cervical rotation problem. Again, this should be about 80 degrees worth of rotation, almost perfectly 90-degree angle. Same thing going towards the opposite side. Important here not to cheat by rotating your chest around. Same thing with the cervical extension test, is we need pure cervical extension the moment we start to see the chest move forward. So look for the sternum. The moment the sternum here starts to move forward, we know we've run out of cervical extension and we're starting to compensate lower in the spine. We want to stop the test whenever just before we start to extend. And so we get a true number and look at what our cervical extension actually looks like. So these are range of motion tests that we can do just to get a good understanding, generally, how much mobility we have in the neck and where is there some restriction. So before we go into trying to improve some of these range of motion findings, it's important to understand, why is cervical range of motion important, not just for pain and discomfort, but for golf performance? Well, the thing is vision is important for golf performance, and messing with vision can basically lead to any number of compensations. So if we think about swing characteristics, first of all, anything's on the table if we are messing with our ability to track the ball, keep an eye on the ball, and if we start shifting our vision during the swing. So if we're missing the ability to do a good job of maintaining our look at the ball, any compensation is possible, right? So why is cervical rotation so important for that? We don't move the head during the golf swing, right? We keep the eye on the ball. Well, we do move the head. If I look at this backswing here and I stand myself up and I look forward, or I bring my torso back forward, we see that I'm in left rotation. So the body's moving underneath the neck, but that doesn't mean that we're not getting rotation happening at the joints at the neck, right? The cervical spine is rotating towards the left in my backswing. The same thing through the downswing is we're rotating back to neutral, and now I'm in right rotation. So if I stand up, I'm in right rotation. You can imagine in the backswing, if I don't have full access to left rotation, at some point my head starts to get dragged along. I start having to look from here because I can't do this. So if we run out of that space, we start dragging our head and we have to start looking now with our eyes. Maybe we lose one eye and we can only see, now in this case, out of my left eye, right? So anytime we start messing with that, any compensation is now on the table. Other than that, what are some common compensations from not having extensibility or rotation through the neck? Well, one would be loss of posture. So as I start to rotate through here and I can't keep kind of going or rotating through the neck, is I'll just start to stand up. So I'm kind of standing up out of that rotation, right? Instead of coming around, as I start to just stand up. Beyond that, we might have this kind of flat shoulder plane. So I've lost my posture and now this shoulder plane is starting to flatten out or starting to point straight towards the camera. Now, like I said, beyond that, any number of compensations are possible. The body will do all sorts of things to try to keep stability here onto the ball. So vision onto the ball. It'll prioritize that above just about anything else. So we have shortened backswings. We'll do anything. We'll start to sway or slide. It'll really do anything to try to keep your eye down at the ball. Now we have to fix or compensate last second to fix the compensations that came from not being able to rotate our head. Okay, getting back to neck pain. One of the first kind of lowest hanging fruit, easiest things we can do for generic neck pain, whether it's even disc involvement or more of a facet local irritation, whatever it might be, we can get results from a movement like this. Well, we call this as a McKenzie cervical extension. It's a simple movement, but it can be great for a lot of people. What this movement is we want to establish a chin tuck position, and then we're retracting the head. So what that looks like from the side is getting kind of out of this position here, and instead we tuck the chin, and then we draw the whole head back. So think about flattening your face to the wall in front of you, so it's kind of parallel to it, and then bringing the whole head back and away from it. That's what you can think about. This is what we call cervical extension with deep neck flexion, right? So we're pulling this thing back. We're getting these deep neck flexors to start to turn on again. That's what we want. Now, what we can do is simply just do reps here like this, where we're starting to play with cervical extension. We pull back in, deep neck flexion, and then we can roll out into pure cervical extension. One of the key concepts here is that we're just spending more time at end range cervical extension. What everyone misses from their life, being stuck here. A lot of times this can be so relieving to a lot of symptoms if we do enough reps and get into true end range. So just taking time to do reps like that can be great. We can do the same thing off the edge of a bed, table, or bench, where I want to start in this retracted position and then try to maintain that for as long as I can as we pull into cervical extension. Even give a wiggle at the end. So this is low-hanging fruit for anyone with neck pain. What we can do is take that position, or at least this retracted position, and apply it to other movements as well. So this is our DNS 3-month prone position. What we're doing here is starting with our elbows at about eye height, or maybe a little bit higher, maybe forehead. And our wrists should be out in front of us pretty loosey-goosey. So most of the pressure is going to be going into the edge of the elbows there. And these can kind of be plopping, right? So we don't have much force actually into the hands. The key start position here, with the elbows where they are, is that cervical retraction. So we want to think about tucking chin down and then pulling your whole face without changing the angle of your face up, right? So it's this tuck and up and back. Again, when we tuck, we don't want to untuck as we pull that head back, keep it tucked, okay? So that is that cervical retraction, deep neck flexion position. What the DNS 3-month position is here is we push ourselves up through our elbows, and this is loose, and we want to keep that pressure out and away, thinking about pulling these shoulder blades away from each other as we go up and out. And then, again, we can even tuck the elbows out and down, which gets a little bit of lat tension through there. What we don't want is any hypertonicity here of these upper traps. So we don't want the traps participating in this pull. We want the traps off. So some cues we use is going down and away. And then if we need to, we can pull back just a little bit to get lat, which will turn off these upper traps a little bit, okay? We're just hanging out and holding this position. Your low back muscles should be completely off. We're just using this kind of upper half, and we're hanging out here and breathing. Same thing, chin tuck, retracted position as we do this. Nothing else is working besides a little bit of the shoulder, a touch of lat, and we're hanging out, breathing in through the nose, out through the mouth. If we can maintain this position, we start to drive some extension back into the CT junction area here. We get cervical spine, deep neck flexion with extension or retraction, right? So we get to work those muscles in that position statically while we turn off these what tend to be hypertonic muscles in that upper back and neck region. So all these muscles that have been working overtime, we get to turn off, and we get to reintroduce these muscles that never get any action anymore by using a position like this. Give it a shot. Now, what are some options to start driving rotation back into the cervical spine? You can try a couple of these movements. Always remember to continue using some deep neck flexion and retraction through these motions here to continue to drive a little bit of extension. That being said, we need to open up some rotation. Try these next two movements here and see if we can start to draw out more cervical rotation through there. If we open up some space and create stability as we do this, we can relieve some symptoms and hopefully long-term have no longer any issues in the golf swing or while exercising. This exercise is helping to turn off these superficial muscles as stabilizers of the neck and shoulder, and instead is turning them back into prime movers as we activate the deep muscles to again do their job of stabilization while the superficial muscles do their work to actually move the joints. So what this looks like is we're laying face up. We have a band. We'll start with our hands out to the side, applying, again, using this band to create a little bit of muscle activation through the chest and neck. As we have that muscle activation, all we're going to do here is rotate our neck, trying to reach end range of motion as we go along. We can do this for reps. We simply do the same thing, but now on a diagonal, getting a little bit different activation through that chest and neck. And we're going to rotate. Same thing here, trying to reach end range rotation. Letting all that muscle work come from the muscles that are doing this to the band, creating tension in the band, and trying to let everything else go loosey-goosey and relax. We do the same thing, opposite diagonal.
Really working on letting the muscles creating tension do some of the work, and then letting everything else in that chest and neck try to be as relaxed as possible. Go ahead, give it a shot.
Okay, this is our DNS 5-month upper body roll. The position here, we're laying on our side. We can use a couple of different positions for the lower half. We can be at 45 degrees of hip flexion. We can be all the way up here at 90, maybe somewhere in between, doesn't matter too much. The key position is we don't want the shoulder out in front of us. Try to kind of draw it back underneath your shoulder. This shoulder should be stacked right on top to start. First thing I want you to think about is getting as wide as you can between the shoulders. So try to get this kind of broad, wide chest. You should notice as you do this that we get a little hole that opens up right through here. So a little bit of daylight here. So long as we have this daylight here and we're staying kind of wide, then we're in the right position. We can work into a little bit of deep neck flexion here as we do this, a little bit of retraction. We're trying to keep and maintain this position throughout the movement. What we're going to do, keeping this width, is roll over this bottom side arm and shoulder. Roll, roll, roll. Let the chest come around, around, around. Hold here, kind of at your end range rotation, keeping this width. Push, push, push. Build the pressure cooker, I like to say. And then use that tension slowly. Now we're going to open back up. So what we're doing here is as we start, is I'm pushing this elbow down. It's essentially looking like this, and then I'm continuing to try to do it, but the ground is in the way. This should create some tension in the shoulder, right? The shoulder capsule, the rotator cuff muscles. Keep that tension. Let this shoulder stay as wide as you can as it rolls. Think about scraping the wall over there. Reaching for the wall as you roll, keeping that width. I'm continuously pushing down here to control my weight as I roll forward, going as far as I can. I can rotate the head with it. Hold here for 5 seconds, push hard, but don't let it start to unroll. Just push, push, push. And then use that tension and that connection you've built to the shoulder to open back up. You get a lot of activity here around the whole shoulder joint. And you go just about where shoulders are stacked, a little bit beyond, and then start to roll back forward again, nice and slow. Okay, so that is the DNS 5-month upper body roll. Give it a shot. So let's look at some golf swing specific drills and movements we can do to help reintegrate some cervical mobility back into the swing itself. So try these next couple of drills, whether you're at the gym or at your house before the range and then at the range as well, to see about reintegrating some of this cervical spine mobility back into the swing so you can use it while you're at the range and you can use it while you're playing golf. So a simple drill we can do here is this kind of head on wall backswing and downswing. All we're doing here is creating some stability at the head, trying to find our golf posture, standing far enough away that we can do that. Hands go on your shoulders, and we just want you to rotate without changing the angle of the neck, or sorry, the rotation or twist of the head. So don't let your head come along for the ride like that or like this. Keep that same spot on the wall as you just rotate the trunk, pelvis, and hips underneath you. Rotate the whole body underneath you just like you would. The wall gives you feedback to keep your head exactly where it is. We start to teach, rotate back in, cervical rotation back into the golf swing again, right? So once we've opened up some mobility and some space for cervical rotation, we then want to use some cues to bring that back into the golf swing so you can use that new mobility and space that you've created and get away from the compensations that you've been using for who knows how long and start to work that back into the swing so you don't have to think about it anymore. You just have access back to that cervical rotation and you can use it as you need it. So if you've had cervical rotation or extension issues throughout the golf swing for a while that have been creating pain, discomfort, that's caused you to now compensate in your swing and say we've lost our ability to maintain our posture. Now, having cervical rotation issues will create vision issues, which essentially can create any compensation under the sun, right? So anything can go wrong if your vision is a problem. Let's say if early extension or any sort of postural issue was a problem for you as a compensation for whatever it might be, here's kind of a catch-all drill that we can do that'll help you maintain some of your posture, some of your angles, and different things like that. So the drill here is we're simply going to line up with a ball. You can do this at the range. And I just want you to raise both heels slightly off the ground. So we have both heels maybe an inch off the ground. All you're going to do is rotate into your backswing. We've already improved your ability to rotate through your neck. We've improved your cervical rotation. We've worked on integrating that into the swing a little bit. And now we're going to use that rotation, but we want to address all those other compensations that have come along for the ride. So we're able to rotate just like we need to. As we start to initiate this downswing, all I want you to do is now sit back onto those heels. So we start here with our heels up about an inch. As we come down into the downswing, we drop those heels, which should kind of give you this cue of hips back as we rotate down and through. So what we can do is hit some balls, starting with our heels off the ground. As we come down, we slam those heels down, keeps us back, feels or helps us cue us to what that pelvis should be doing in the swing. And we can take some swings like that, 80%, 70%, maybe up to 90% swings. Hit 5 or 6 of those just like that, and then try to get similar feeling at the pelvis through your full swing. This is just a way to work on posture in the golf swing after we've been compensating for whatever issue we might have had in the past, whether it be a mobility issue, some pain somewhere, or even a cervical rotation mobility loss. A way to kind of revert back and fix any most compensations that come from issues like that is trying to drill like this, raising both heels off the ground and then slam them back down the moment we initiate that downswing. Go ahead, give it a shot. Okay, so we've worked through cervical mobility. We've tested some cervical mobility. We know how important rotation and extension is. We have some ideas of what causes upper back and neck pain. And we've tried a couple things that can start re-improving or reintegrating some mobility back in the neck while integrating the motor control and stability at the same time. Always better to do these drills that actually include not just the mobility part, but also the strength stability portion as well. We've taken a look at a couple drills that we can try to start to integrate this back into some swing mechanics, and then kind of a catch-all swing drill that'll help re-improve or bring back your posture and working through posture positions through the golf swing. That is often an issue when we have cervical rotation loss, is your ability to maintain your posture. So try these movements, try these drills afterwards, and see if we can start to feel a little bit better through the neck and upper back in the golf swing. Again, the compensations from having vision problems is endless, and vision problems happen when we can't rotate through the neck. So give these drills a try if that's an issue for you. I hope they help. Remember to like and subscribe, share the video if you found it helpful. And again, more videos like this every month. Looking forward to answering any questions you have in the comments. Thanks for watching.